Welcome. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber, and I want to thank you for joining us for February 4th, our cross-industry public health update right here in Boulder County. We will get started in just a minute, but I just want to remind you to put your questions in the Q&A. We'll push out the information in the chat. We're joined this week and every week by Lane Drager, but he'll be taking over the main presentation piece. So I'm going to hand it over to Lane at this point. But as a reminder, put those questions in. I'll get them asked, and hopefully we'll get through all of them in this hour period.
Thank you, Corinne, and thank you everybody for joining. So we're going to do very similar to what we've done for you for months and months now, but we're going to share our epidemiological update. We're going to talk about the state dial. There's quite a bit of changes we believe are coming. And again, I'm going to share at least draft proposals that we have seen. We have not seen a final order, so we don't know what that will look like. But ultimately, the state will issue a public health order that kind of captures all that stuff, and then hopefully have plenty of time for your questions and answers. I did add a fair bit of extra epi data this week just because I thought it was all relevant and I thought it was important for you all to see. But as of right now, there hasn't been a change to the dial. We are still in the orange status. Our 2-week cumulative incidence rate is also in the orange. We're at 270.5 cases per 100,000. And that has come down a little bit. So we've seen that trend across the entire metro area, that the overall case counts have continued to come down. And we're very happy that Boulder County is kind of the lowest for the most part for the whole metro area. So that, again, kudos to businesses that are doing a great job and our community that continues to help bring that down. Also, our 2-week positivity rate is in the green at 3.5%, another one that's very low, especially for the metro area and for the state. So that is also a great sign. We do believe that people are continuing to test, so that's an important piece. Even though vaccines are starting to flow, it is going to be important for people to continue to test probably throughout the entire duration of our kind of response. And again, another good sign, seeing our hospitalization status, 12 days of decreasing or stable admissions, putting us in the green category, which is again a great sign. We were really about the same place where we were last week for that. So while that's stable, it's a good stable. So just as I mentioned, we're doing extremely well. Here's just a quick glimpse that I wanted folks to know, especially for those of you that may have businesses across the metro area or do business across the metro area, but we're doing very well. You know, as I mentioned, we're really in orange and green in all of our metrics, and you kind of see where the other folks are. But overall, things look dramatically different than they did where we were near the end of last year when almost the entire state was in red. So again, good trends. Grand County, unfortunately, having some challenges. So that is why that's thrown on there, because they're really seeing some significant issues out there, even though that's not a metro county. So this one is really looking at our long-term care facilities. So this is a huge driver of disease and severe disease in our county. That's why I wanted to show this. And this is a very positive trend to see this finally dropping off again, because often a lot of our deaths when there's disease in long-term care facilities are from those locations. And we have begun doing vaccinations within the long-term care setting and for those that are 70 plus. So that is also going to help really continue to limit those outbreaks and disease there. So this is a graph we've shown you every week. And again, what we want to see, we wanted to see that giant mountain of a spike that happened late in the year drop off, and it has continued to do that. So while we're still not down to where we were during the summer, it has dropped off quite a bit. So we're seeing about a 59 case per day average, and that's a decrease from where we were last week of about 68. So again, all going in the right direction and what we want to continue to see. This super busy graph, but this is again just showing you across the whole metro area the same trend is happening. So we're seeing all the counties really drop off, which has been fantastic. What you can't really see because it's pretty tiny is Boulder is red, and we're this nice red line at the bottom. So we're again doing much better than a lot of our peers, so which is great. Boulder County residents, this is another one we've shown you in weeks past by municipality. Again, similar trends to what we've seen for the last few weeks, but much better than that spike we saw at the beginning of the year. So, but things kind of leveling off. We'd still love to see it lower, but again, the trend of downward or leveling is still better than that upward trend. We've seen about 185 cases in the city of Boulder in the last week, 128 cases in Longmont, 73, Lafayette, Louisville, Superior, and then 69 for our other municipalities in unincorporated county. This trend in new COVID cases among Boulder County residents by age, the reason I highlight this is we are seeing some issues. We have specific issues amongst very young, sort of that 0 to 9 age group. We've seen a 7% increase. And then 18 to 22-year-olds, which again has been a big concern. We saw that outbreak related to that age demographic, specifically with CU last year. That is an 18.2% increase. So something we're very concerned with and continue to monitor, especially given that CU hasn't fully gone back to in-person learning. They haven't opened up the dorms yet. That will be happening in the next week or two. So a big focus for us in collaboration with CU and the city of Boulder. Again, this one looking at our disparity issues. Unfortunately, we are still continuing to see a lot of issues within the Latinx community. 74.8% of our cases are from that age demographic as of the beginning of the week, which again is a very disproportionate representation for that community. We're also seeing higher rates of the hospitalization and deaths within that community. And we also have concerns because of our 70+ groups, we're not seeing that group represented like they should be in vaccinations. And partially that is not often are folks that are Latinx in long-term care facilities, which has been one of the targeted areas for getting that vaccine. So it's an ongoing effort of our folks that are working within our communities to increase those vaccination rates and help turn that tide. But speaking of vaccinations, this is kind of our, as of this week, earlier this week, where we're at with vaccinations. So 21,500 people that had a first vaccine, a little over 7,000 that have had the full course. So about a little over 28,000 total that have received it. Again, our challenge is the amount of vaccine that we're receiving. There has been a very low amount that's been coming into our county. And then we had a few weeks there where the state had reallocated to do some super vaccination clinics that they were organizing, which pulled away from our clinics here getting vaccines. So we have much more capacity to vaccinate than vaccine that's coming in. So that continues to be the challenge. And again, here's just a quick who's gotten vaccines. Again, those target population, that 70+, we have crossed the 50% threshold, which is great for our first vaccine. So that will continue to go up because that is still the priority population right now. And then we'll be moving into the next phases of folks once we're able to complete that. All right, and we're getting close to being end of the epi data, but again, I thought a lot of this is still very important for you to be aware of. So this is really looking at again, that race, ethnicity information of kind of who's gotten vaccines specifically for that 70+. And you can see of the 50, some percentile that we've hit for that, 88% of those vaccinated. 90% of those are white. So that's again where we need to target that population. Only about, I think, 5% of the 70+, well, 2.7% of the 70+ are kind of in our Hispanic Latinx community, whereas 5.3% in our community. So we're missing that mark still. All right. Something else I wanted to mention, because I know some people have kind of felt like maybe there wasn't a lot happening related to when I talked about that outbreak within the age demographic, but there was substantial activity, partnership with the city of Boulder, looking at violations for public health orders. And as you can see, as we saw issues on campus, higher numbers, 22 citations. And then once we really were able to crack down and put some orders in place, that really dropped down. We didn't have any issues in December, and January was very minimal. So hopefully February does not have a huge uptick, but it's been a substantial change from where it was in the fall. All right, so just some key takeaways. Our cases are still decreasing, which is great. Same with long-term care, cases falling, very important. But those upticks, which are of grave concern, especially for the ones that are entering into school-age kids, those 0 to 9, and then specifically our 18 to 22-year-old populations. All right, now I'm going to talk to you about a whole lot of possible. So we don't know where the state is going to end up. This is a link that'll be shared when Corinne sends things out, so you can look at it in more detail, because I only I'm sharing a few snippets of it. But we don't know if this is where things will end up. But this is what we have seen as a draft proposal from what the potential change to the dial is. And we're hearing that potentially the state may launch something next week. So this is a lot on here, but again, you'll get this slide so you can dig into it more. But really, this is kind of a walkthrough comparison of each, where the old current dial is to what the proposed new dial is. And the big change is this slide here, in that the metrics to be in one of the categories are what is really changing. They'll be changing from a 14-day rolling average to a 7-day, and the thresholds are decreasing. So as you can see, right now we're in that orange category well, actually we're starting to dip below that even. So we're getting closer and closer. And if we get this new metric, we potentially could move to a yellow state on the dial. What doesn't change in the new dial is the thresholds within those phases of the dial. So you won't see changes in how many people you can have in orange old to orange new. But what does change is, again, you'll move more quickly to those other stages of the dial because they have changed the thresholds. And that's all spelled out in that link that you'll be able to see. This is what we've seen as how we would move between levels of the dial. So something that we've kind of shared in the past, where we do need to show stable metrics within the level that we're moving to for at least a 1-week period. And then conversely, if we are starting to see a backslide, that would be a place where there's kind of that ongoing dialogue with the state of when we're moving backwards. But the intent would be, even though it says here, we need to submit and the state needs to kind of approve, that hopefully is one of the things that is changed in their final version, where the state is making all the movements one way or another. So there's not all the need to petition back and forth. And then this is, I think, an important one, is a rough projection timeline of what to expect from the state. Again, something we hadn't seen at all last year, to never know when they're planning things. So this at least gives us some ballparks that this current change to the dial, we're expecting likely next week. They're proposing another update sometime, in the next 2 or 3 months, likely as vaccines are rolled out. As the thresholds are hit, they potentially will continue to change the dial. And then a final update sometime in the summer, when hopefully we're seeing very large community-wide vaccination levels. So again, all projections, we're not sure what the final versions will look like, but this is the best information we have, so we did want to share it with you. Now we're going to jump just quickly. We're not going to spend a lot of time on this because we've dedicated an entire session tomorrow to the 5-star program, but I wanted to make sure Corinne had an opportunity to share, any highlights, because I know regardless of where we're at, she still is bombarded with questions and has been doing a lot of work on this. So, and again, we're kind of in that active place. So go ahead, Corinne.
Sure. So we will be going live with our application for businesses starting tomorrow. If you submitted the interest form, you will get a direct email telling you it's live before it's on the website, just because we were able to train enough inspectors to meet the need of the people that filled out the interest form first. And then we will put it out live. Inspections will start next week. We have been training inspectors all week to start going out into the field next week. All of the resources that you need, the sign resources, the HVAC self-certification checklist, the checklists, all of that are on the 5-star page, and they've been there since Tuesday. So even the application questions are up, so you can prepare for the application to go live. If you are a multi-licensed facility, so for example, you are a hotel, but you also have a licensed restaurant, you will fill out a separate form. You will have to actually get each of your facilities are actually separate. We have to look at each of them as a separate entity, but we will be sending out one inspector, which is why you're filling out one form. So your restaurant, your hotel for that indoor event, or if you have something else. So that's how it will work. I will go through some of the specific questions in the question and answer period, but just know that if you would like to volunteer to be an inspector, to get trained to go out and be an inspector, we really still need those to meet the demand in our community. The landing page for 5-star does have the link to be able to sign up to be an inspector. And then we will have a webinar tomorrow going into detail on the process and answering questions. And we'll have hopefully Lane on that call, but also H2 Manufacturing Solutions, the third-party vendor that's also running the Denver program, which launched on Tuesday. So we're working through some of the things that happened through Denver to make sure they don't happen in Boulder. They're going to be on as well to be able to answer questions. So please join us tomorrow. That information is also on the landing page. I'll put the landing page information in the chat. And then I know there's some specific questions about 5-star. We'll get to those in the Q&A period.
Thank you, Corinne. Another thing we've also been trying to drive home is having people and promoting signing up for the exposure notification system, so that, again, if you are in proximity to somebody who is ill, you would get that notice to help, again, get advanced warning and help you start that quarantine process. This is our Thursday update. You've already found that, so that's great. We will be doing the session tomorrow on 5-star. We do have the recorded session that goes out also today in Spanish, so that's something that for those that need that, please disseminate that and share that widely. And then, as always, this is how you can reach our business team as well as the call center. And I think with that, we can move to question and answer.
We have a lot of questions and we have a lot of 5-star questions. So I'll try to group the 5-star questions together and we'll try to get them answered. But again, if you want to go into specifics on the application, I suggest joining us tomorrow as well. And there's a lot of questions about the dial. I think there's a lot of fear about the uncertainty of moving to a 7-day. And the question is, could we be jumping back and forth week by week between levels, or is there going to be some buffer time in there? Because this is hard already as it is, moving back and forth and going from orange to red to orange to yellow. How is that going to work?
Yeah, I think we need to see the final version of the public health order update so we can read all of the details. Always the devil is in the details, so that's the important piece. We believe that it won't move instantaneously. So again, we won't move more favorably instantly. We have to show that stability for a week. We think that the backwards will also be the same, that if we just dip down, it would need to be a trend. So if you cross one of the metrics, say our case counts go backwards, is that the trend, or does it turn around and go right back the other way? So again, we don't believe it will be an instantaneously. As soon as we move to that, now you have to move as well. But if we start to see that trend, then it would likely move. And we will be sharing, whenever we're going to move, we'll be broadcasting that very broadly. We won't wait till our weekly session to share that kind of information.
And because they widened the level in which the numbers are, it's going to be a little bit harder to move up and down. So if it's now, I think, where it was before, yellow used to be to 175, now it's to 350. There may be a little bit, and we're looking at the 2-week cumulative, number. It might not be the same kind of jump up and down. I don't know if our numbers would go from 100 to 400 in a period of 1 week.
Yeah, I mean, outside of a significant outbreak, we just haven't seen that level of change that quickly, but we have seen our numbers jump up certainly within a week or so. So again, I think if we saw that happening, it would likely be a case where we would be changing dial status within that week.
And the local health departments still have the ability to create more stringent, more surgical orders as well to try to hit where particular issues may be happening within a county too, correct?
Yes, as do municipalities.
Okay. Is there an assumption that higher rate among 0 to 9 is because of the school reopening, or is there another potential source of that?
Yeah, it's hard to track that down and know. It's probably a combination of things. We know, especially when it's 0 to 9, those younger kids are certainly not masked as well. They don't have as good a hygiene practices. It may or may not be related to childcare settings, and probably not as much school. The schools have pretty strict programs, so I don't think it's the schools itself, but I think it's likely people having play dates and doing a lot of activities where kids are intermingling, where they potentially aren't masked and not social distancing. So those are the drivers of disease. It's just hard to know for sure which setting it's happening, but we do know childcare and school settings are controlled pretty stringently. Whereas what you do in your private home and when you have, activities with your kids, those are not policed and overseen very closely. So those are likely much bigger drivers than school.
Okay. Another dial question, and I think just want a clarification on this one, and we can clarify for the person that's asking, was whether or not we have a plan to submit to the state to move to orange, since our metrics have been in orange for a couple of weeks, but we're already in orange.
We've been in orange. The state moved us to orange when we were in red. So it's very challenging and confusing. We understand that, but we've been in orange for quite a while. So we don't need to do anything to change our status. To move to yellow again, once we see our metrics qualifying there, we're hoping that the state just starts moving people based on their qualification to be moved, rather than us having to go through the steps of petitioning and getting approval.
I think there might be just a little confusion because this is a company that's looking to apply for 5-star. And the communication around that was we had to have metrics that were in orange, even though we were in orange. We had to have metrics that were in orange for at least 7 days. Our metrics have been in orange for at least 14 days. And when we got approved for 5-star, we were approved non-contingent, meaning that when a business applies for 5-star, is inspected, and gets certified, they can now operate in yellow. So that might have been one confusion that came across.
And should we qualify for yellow, that would give businesses the opportunity to operate in blue. So there's some potential big shifts depending on what happens with the final dial. If we qualify for yellow, that would be a huge jump from businesses that had been in orange and could suddenly be in blue. So pretty big shift.
Okay. So some questions about the vaccine schedule, and I get this a lot from our essential manufacturers. Because the frontline essential manufacturing is in 1B, and then you move to 2, which has the rest of the essential workers. So just the frontline essential manufacturing. Is there a timeline when those businesses might be looking at when they may be coming up to the vaccination schedule?
Yeah, I mean, the best we can answer is once the groups ahead of them are. So it's so contingent on how much vaccine we receive. And again, our supplies have been unfortunately dwindled instead of increasing. So so it's really hard to project when we're not getting stable levels coming in. So we have a hard time projecting when we don't know how much we're going to receive when the next group will get it.
Yeah, I've been taking calls from some manufacturers in the area, and I've said it's going to be a little while. And one thing that you can do, and even the plans on how businesses can work with providers hasn't been fully baked yet. Like that's something that will be coming out as this becomes more baked, and we don't know what changes will happen during that time. But I think that businesses also need to look at their internal plans, because not everybody is a frontline essential manufacturing worker. Some are office, some are just essential. So looking internally to figure out how your employees classify so that you have a plan as well, and a communication plan, because we've already seen this happen within some employers, where it's, well, why am I not getting the vaccine? Why do they get the vaccine? So working through some of those internal processes before, as this stuff is getting baked on the statewide level, is some of the advice I've been giving to some of our local manufacturers. And as soon as we get this information, we will push it out. But again, some of these changes are not often communicated before they happen. And so, the addition of 65 to 69 and the addition of teachers and moving those up then moves back some of those other categories for a little bit in the timing.
Yeah, it's very job specific versus business specific, as Corinne mentioned. So if your job is to work completely remotely as part of a business that is still a critical business, you are not a frontline worker. So so it will be very job specific in the business. It would be in their best interest to have those categories teased out so that when it is your time, you know which group and how many people that is, so that those vaccine allocations can be coordinated.
Because even within the school districts, if you're a teacher that works fully online, you're not going to qualify right away either. So there is that internal to your organization structure that you probably need to look at. Another vaccine question is that people have heard that Walgreens and CVS and some of those are starting to provide the vaccine. Has that already started? When will that begin? And what is the relationship with providers? How is that working?
Yeah, so this isn't where I'm working, but we do have folks that are coordinating all the vaccine components. There's a whole host of providers that we have qualified to do this, but it's all based on how much vaccine we're receiving. They're still vaccinating the priority population. So just because one of the providers has vaccine doesn't mean anyone can come in and get it. It's right now, again, you would need to be a 70 plus. Then you could potentially go to the different providers to get that vaccine, but you can't as somebody who is not qualifying in one of the current phases to get vaccine ahead of time just because of that. And a lot of those providers still are getting very limited supplies. Some of them are starting to work with larger businesses, school districts, and things like that to plan larger vaccination clinics. But again, it's only for the priority group, not for the general public or the general business.
Okay, so more vaccine questions around, and I think we can get all of these questions into one category, is that there's a lot of concern that restaurant workers, hotel workers, people that interact with the public, massage therapists, people that aren't considered necessarily essential retail, where do they get put into this classification line that the state has put out, or is that something that's still being worked through?
Yeah, I don't have a final answer because it's felt, unfortunately to us, like it's continued to shift every time we think we've seen where the final groups are. There's a shift from the state. So I don't think we've seen a final answer for, all those different essential workers, who is qualifying in that group and who isn't. If all of those folks are added in, it will become a very big group to need to get vaccinated. So
into that frontline 1B,
yeah.
But then it could move to 2, where we have the rest of the essential workers but because right now restaurants aren't actually, are they considered an essential worker? They may fall into 3 right now with the non-essential retail. So we're not even sure. We've gotten a lot of questions. I think there's still a lot of questions that aren't being answered. But it's not Boulder County Public Health, it's the state that's really guiding those.
The state is setting all the levels, and we are required to follow it in order to continue to receive vaccine. So, and at this point, yeah, we haven't heard a final decision on that.
And I'm going to say this we're kind of building a bus as we're driving it in this vaccine piece in a lot of ways. And, you know, it's one of those things where it's, as we get more information, we'll send it out. But I'm working with industry associations and we're working with businesses. Some of those answers don't exist yet. And I don't think we're able to provide the information quite yet. Like, is something an oversight? I don't, you're not able to answer that because you're not in the meetings with the state. And in some cases they're adding things in and changing things. And even when they add in groups, we still don't have the vaccine to meet the needs of those groups right now.
Yeah.
Okay, I'm just making sure we get through all the vaccine questions. So there's questions about where small schools that don't tie up, that don't align with school districts or some of those other educators, how they should get information about vaccines.
Yeah, we have regular meetings like this with all the different components. So we have one specifically for small and charter private schools. We meet with BVSD. We have regular communications with St. Green Valley. So we have folks that are working with them very closely on all of those aspects. So they're getting regular communication on where things are at. And they will also be doing exactly what we've asked you to do, is looking at all their inventory and getting the number of folks that are going to qualify to get vaccines. So we have those counts. And again, it excludes people who are not actively in a role where they're interacting with students. So if they're doing remote, then those teachers will not be in that list of folks that are getting vaccinated right now.
Okay, so the question is, can you lend some insight as why the dial never gets us over a 50%? Will we ever be able to operate at 100% again? What's that look like?
That's a good question. I don't know that. I think even once we're fully vaccinated, it'll be interesting to see what the state's decisions are, because we're seeing this virus mutate and seeing quite a few different strains, and that is very concerning. So the precautions to prevent the disease won't change at all. It's ensuring that you're socially distancing, wearing masks, washing hands, staying home when you're sick. So the more we go back to everybody, packing into locations, the risk just goes up dramatically. We know that our communities will not fully vaccinate. We have, some strong anti-vaccination groups, certainly within Boulder County and across the state and country. So there's going to be people at risk. And even once you're vaccinated, you can carry the virus and give it to others. So I don't know if 100% is still on the horizon, to be honest. So I don't know the answers to that. And I'm just very concerned that we open things up too rapidly when we're not ready. Because right now we have a very small amount of our population vaccinated, and we're already relaxing things quite a bit. So those are concerns. There's been a lot of relaxation related to sports, again, driven by public outcry, not by public health science. And we're seeing the outbreaks coming, so that it's not a surprise. There's been wrestling outbreaks in Tri-County. We've seen a lot of instances of diseases here in our school districts, in sports groups. So again, not surprising. And those have huge potential to impact businesses, because as you all know, the orders have a lot of stringent requirements on businesses. And then, different vocal groups are advocating for their need to participate in, different sports and different activities. and it jeopardizes our community's ability to function, jeopardizes the kids' ability to be in school. So, we're making some significant decisions that could compromise larger groups of our society for small groups' interests.
So someone did point out a really great thing. Fact of the matter is, when they changed the website, the state vaccine website, and they added the 1B3, 1B2, 1B3, in phase 2, they took out the rest of the essential. Phase 2 has been changed, so we'll have to get some clarification on that. It might now be general, everybody's now falling into the other categories. So thank you, Courtney, for pointing that out. They keep changing the diagrams and the charts and everything on the website. So as we get more information, we'll send that out. But yes, everything is changing. All right. So we have some questions about specifically sports, since you brought it up. Has the spectators the order prohibiting spectators expired?
Yes, for Boulder County. For the other metro counties, I think those are still in place. They have not expired yet, but for Boulder County, it has.
Okay. So what are the rules around spectators? Just maintain social distancing and your facility rules, or?
They also need to be 50 feet away from the participants. So that's one significant piece. And that's based on our attorney's review of the public health order. So that legal decision, and Jeff has, reviewed that and adhered to that. So we elapsed our ban, but that is the legal interpretation from reading a confusing order.
And then where do youth sports organizations looking to apply for the CHASA exemption, where do they go to apply for this variance? And are those exemptions only for sports that are CHASA Section B right now?
Yeah, I don't know. That's handled through the state. We don't have any involvement in any of the variance process for any of the sports. That the state is the one that's doing all of that. So I can't really give you a good insight on that because we are not asked to look at. We're not asked for any opinion on. The state has just moved forward with all of that.
Okay. And are there different levels for adult rec sports versus kids?
So unless you have a variance, you have to follow the dial requirements. So again, it's looking at what is and is not allowed in an orange indoor sports or not. So.
Okay. So if it's not the CHASA variance, then it's you're operating under the recreation guidance. And right now in orange, it's still pretty restrictive under the recreation guidance, whether it's youth or adult. If we move to yellow, then we might be able to have games and some of those other pieces that fall under the guidance. Have you heard any update about the mask mandate? The governor's monthly expiration of the mandate or the mask order is set to expire. Do you believe that will be re-upped?
I'm not sure. And for us, it's kind of a moot point. It's more important, I think, for other counties who have not put a local mask order in place, but Boulder County has had a mask order before the state did, and it is into perpetuity until we sunset it. So we have both indoor and outdoor mask requirements. So outdoor, if you can't socially distance, and indoor at all times, at least for 10 and up. And then by municipality, they also typically have orders. Louisville is the one that comes to mind that I think is 3 and up. So, but it's important based on your jurisdiction to know what your local mask order is. But our county orders are not going away. So regardless of whether the state renews theirs or not, our county mask order will be in place, and it's required for all sports. So,
and the only reason that the governor's order expires is because he can't put in an order for more than 30 days. So it expires, and in most cases he renews it. Just like the dial, people come to me and say, I hear the dial is expiring. No, it just means that order he put in for 30 days and it'll most likely just be renewed, the order. So Haven't heard about the governors, but we do know the Boulder County, Louisville has an order, things like that.
Boulder has an order, Longmont.
In orange level, are outdoor adult league sports allowed?
Outdoor sports are allowed in orange, and you just have to follow all those recreation requirements within the dial. So we don't have any requirements that are more stringent within the dial structure by sector. So all of it defaults to, where things are at within the state dial.
When do you anticipate we'll be allowed to do things like billiards or foosball, or are those going to be allowed anytime soon?
That's a good question. I would say it's probably more dial dependent than anything. And I think in some circumstances, we're out of the red phase. So a lot more of those things start to have a possibility.
But are there going to be specific cleaning? I mean,
yeah,
I know under the 5-star, anything that's like shared usage is not recommended. So because for cleaning purposes. So I think there's probably going to need to be some conversations about that. But I've gotten a couple questions now. Can we start billiards if we limit numbers, have masks, do reservations, socially distance, and clean the equipment?
Yeah, I mean, while it's not a sport, it's similar to those indoor activities where we still have to have the social distancing, can't have shared equipment, things like that. So those will be the keys to letting those things kind of move forward is that they have protocols that clearly address this, where they're not sharing cues and all that sort of stuff.
Okay. So I have I'm just making sure I'm getting through some of these questions that are together. If we have one bathroom that has 2 stalls that are separated by a stall wall, and I don't know if most likely the stall wall doesn't go all the way to the ceiling, can we leave both open, or do we have to close one off?
No, because it's not creating the 6-foot separation. So unfortunately that would need to be restricted. So it gets you kind of down to a single stall.
And under 5-star inspections, just we measure from center of toilet to center of toilet. And if it's less than 6 feet, then one of those toilets has to be shut down. Even if there's a wall, it's not a floor to ceiling wall, it's not a separate room. Okay, we have a bunch of 5-star questions, so I'm just making sure that will Boulder County Public Health be putting out specific guidance for operation of outdoor pools?
We will be just sharing whatever is required within the state order. We won't have anything that's more stringent than that, barring some radical shift to state orders that sort of removes everything. So it's no different than what's currently allowed. So obviously it's more the outdoor climate conditions that are limiting outdoor pools, but they could be in operation right now were it not for that we're in winter.
Would Boulder County Public Health hold back the county from going to yellow if the state moved us to yellow?
We don't foresee that. I guess it would just be if they moved us and our metrics aren't warranting it, which they did when we were in red, moved us to orange. It's a possibility, but we haven't had any discussions, talking about that. If our metrics are warranting it, it likely will happen. So.
Okay, so if you live in Gilpin County and work in Boulder County, are you allowed to receive the vaccine in Boulder County, or are you restricted to get it where you live?
If you live in Colorado, you can receive the vaccine anywhere in Colorado. So we know that's something that occurs for a lot of folks. They may work in one location and live in another location. So yeah. And if you're getting it through your work that's being organized, and you work in Boulder County, then you certainly can be vaccinated.
Okay, so I'm going to go through at this point some of the 5-star questions, because I think I've hit most of the other questions, and if I haven't, we'll get to them. There were a lot of questions today, and people put them in the chat and the Q&A. So, all right. So some of the 5-star questions. It states that for indoor seating, when customers are not eating and drinking, they should have their masks on for indoor seating while talking, waiting to order, and ordering. Does this apply for outdoor seating? And I want to answer that we're not actually 5-star certifying the outdoor seating. We're looking and inspecting the indoor seating. This applies to indoor seating, and there needs to be signage up reminding customers that when not eating and drinking, they should wear their masks. So, and that it specifically says in there for indoor seating. Do you have anything you want to add there, Elaine?
No, I mean, we just know the risks for indoor versus outdoor are dramatically different. That being said, when you're not socially distancing, you do need to have a mask on outdoors. Obviously, when you're seated, and you should be only with the group that you're with, and those tables need to still be separated outdoors. So there shouldn't be situations where 2 tables are next to each other. They need to be at least 6
It's a
feet.
good recommendation to have it outdoors as well to protect your servers. I think part of this was in protection of servers, making sure your servers stay 6 feet back, but I've seen a lot, that still come up to the table. So just in protection of the servers, the other people at the table, but the specific 5-star inspection or the signage for requirement is for indoor. So this question is, I think this can apply for 5-star and non-5-star. Are we required to refuse entry if we have visitors that refuse to have their temperature taken if they're required to do the temperature checks, or can we simply write down on the contact tracing form refused?
So it would be good to know the sector where this is happening, because as far as for like patrons, and there's not a lot of groups. So this, I'm assuming that maybe is a limited healthcare, or I'm not sure when they say visitor, if that is at a hospital, or so it'd be good to get some more information, and maybe that you can send that to Corinne.
Well, even in like office settings, you're required to get the temperature check of visitors and anybody coming in. And then under 5-star, there's a lot more requirements of taking information on people's.
But yeah, I think if they're not following your policies, I think you can refuse their entry. You should definitely talk to your attorneys on your different processes, but
and as far as the 5-star goes, I will as far as the reporting goes, I'll check on that one, and I have who submitted this and get back to you on that. So the application fee for 5-star, and I have to say the reason we have an application fee is because this is a very pricey program to stand this up, to use a vendor, to be able to do inspections, to do all this. We had to do a nominal application fee. It is $100 per license facility. If you are unable to pay, there will be, so you'll do the application and then you'll receive a response back that says, thank you for applying. To pay for your application fee, please go to this link. Your application process will go through at the H2. The payment is being processed by Longmont Economic Development Partnership. They're the fiscal sponsor of this program. So they are managing any grant funding, they're managing the contract with H2. So they will be doing the invoicing if you need to pay by check. There will be a section on that payment form that says, I have severe hardship, you explain it. And we have gotten some contributions from businesses that are willing to help sponsor other businesses that aren't able to afford. We can't do this for everybody, but we are receiving some donations from businesses. Thank you to those businesses that are donating to help cover the cost of other businesses. So that will be on the payment form, but not on the application form. As far as the complaint process or the compliance process for 5-star, there is a requirement that you put up a sign, and on your actual decal that you will get, that you put on your front door, it'll link people back to the landing page. And there is actually a sign on the landing page now that you can put up. that says if you have a complaint or need more information, go to this site. It goes to the landing page. There is an online form, and as of tomorrow, I'll be putting a phone number up too that people can either call or they can submit the complaint form. So the best method for you to do is use the signage that I put up on the landing page, because it'll direct people to that, and any changes to the complaint process will be done on the landing page and you won't have to change your sign. So there's a QR code, it's in Spanish and English, and there's a link to the landing page so that they can either submit the form for a 5-star certification facility complaint. It also links to the public health complaint form if it's for a non-5-star facility, and there will be a phone number as of tomorrow. I don't want to put the phone number up there until the application's actually live. It's not my cell phone, so we won't be putting my cell phone on there. We do have a Google number that we've created with H2 for the command central to answer calls. Another question is whether or not we'll be limiting, capping the first round of applications like Denver did. So Denver did cap at 500 initial applications. We, at this time, are not capping. We do need more inspectors. So can you volunteer 8 hours or volunteer one of your employees 8 hours a week to get trained to inspect? But based on the interest, we think we can cover the needs currently of the people interested in this program, and it will be rolling. So we could use some more inspectors, some more volunteers, some more resources, but at this time we're not capping at 500. So, you know, get your application in, but right now, based on the interest forms, we should be okay. Sorry, Lane, if you have anything to add, you can. These are all 5-star questions, so I thought I would get through them. So the direct link for the 5-star, so I will send out an email before it goes on the website to anybody that filled out the interest form. The administrative committee for 5-star is meeting this afternoon, and they just have to give the final go ahead, and then that will probably go out tomorrow morning. And then after the webinar tomorrow, we will probably post the live application for everybody else on the website. So we're talking ETA tomorrow morning. Just have to make sure all the bugs are out in the system tonight, and then tomorrow we'll be doing that. Inspections will not start till next week. And one thing that we learned with the Denver launch was that people were immediately filling out the inspection ready form. I'm ready. And then they were getting an inspection assigned to them, and they're like, whoa, wait a minute. I wasn't really ready for an inspection. So only fill out the inspection ready form if you are ready to be assigned an inspector, because if we keep getting cancellations with our inspectors, we might lose some of our volunteers, and then the program will have issues. So please just follow the steps as you see, and tomorrow during the webinar, we'll walk through the steps. All right, so if you are a multi-licensed facility, meaning you have a restaurant, you have an event space, and there's separate licenses, you'll have to apply separately. Now, if you don't want to 5-star certify both of those facilities, but you only want to 5-star certify the restaurant, you only have to apply for the restaurant. So that's kind of where we are. And if you are a hotel, it's not the hotel that's getting 5-star certified because you are an essential business. It's the meeting facilities, it's the indoor events facilities. But this is not a requirement. I think one of the questions says that every business needs to apply. This is not a requirement to do 5-star certification. It's a benefit that's going to be available for you as a business this week in Boulder County to get 5-star certified, to allow you to operate at different levels. It's also for consumer confidence and employee confidence. Woo, the number of questions just keep going up. Okay, so you're required to post signage on the exposure notification for customers for 5-star. It's not required for non-5-star facilities. That information is available in English and Spanish, and you just have to have a poster up. But it's to help expand the exposure notification system statewide. If a rec center offers childcare, would there be two forms, the gym and the childcare? Not if they don't have separate lane. You might have to help me on this one. Not if they don't have separate business operations. It's just the gym, right? That we're certifying on that one.
Well, I'm guessing that they have functionality that they're using for general population, as well as then they also have a child care program. So it would be a question of what are they looking to move into the 5-star program. And I'm not certain if childcare is eligible for 5-star program, but certainly their gym would be. So that we need to dig into that some more.
Yeah, we'll look at that one. The H2 system can look at education facilities, but it's not going to change your capacity of your childcare facility. It's the gym that we're looking at helping to certify at this point. Okay, so if you're a brewery with a production facility and a restaurant, it's your restaurant you're most likely trying to, I think I got this via email as well. If you're a production facility and a restaurant, if you want to 5-star certify your production facility for manufacturing reasons, or for the production reasons separately from your restaurant, then that is 2 separate. But if you're just looking to make sure your restaurant is 5-star certified so that you can follow the capacity limits on your restaurant, then you'll want to do your restaurant. But if you want to do both, you'll have to do those separately if they're 2 different licensed entities. Okay. I think I got that question twice. So if we have, this one's actually not 5-star, but so I'll come back to it. We have 3 locations located in Boulder County, one in Boulder, one in Lafayette, one in Longmont. Do I have to fill out a separate application for each location? The answer is yes, because those are technically 3 different locations. And I wouldn't use the multi-license because that's under one roof, because we're not going to send the same inspector out on the same day because you have 3 different locations. So yes, you have to fill out 3 different, because most likely you have 3 different restaurants. Way we have to report it to the state is by license, so by facility. So it's a lot easier if that's how you apply, because we can't just, if you're a restaurant ownership group, we can't just apply as the ownership group. It's the restaurant that's getting certified. The question, are face shields a suitable replacement for normal masks?
They're not. So a face shield is really used to protect the wearer from hazards for their eyes and their face. It doesn't stop droplets from that person going out into the area. So they're really it's a protection for the wearer. It's not stopping the droplets to protect those around. Potentially, somebody can wear both depending on why they need the face shield, but it doesn't serve to replace a mask.
Okay, another 5-star question. So even though we're looking at the indoor area of the restaurant, the spacing of the tables, and the outdoor area, as far as the mask usage inside, when people arrive, you still have to follow all of the same procedures on the actual, have to have one person within the party. You have to know where they're seated, whether they're indoor or outdoor. You have to have contact information on somebody, whether they're indoor or outdoor. You still have to do the screening and all of that piece. Reservations are still highly recommended. So no visitor at the restaurant is exempt based on where they're seated. On the other processes, you're still going through the same systems, and it's the same systems you're going through. It's just that the technicality is the signage for the mask wearing is for the indoor seating. What level of dial would buffet style banquets be available?
I don't think we'll see that until we're out of all the issues. The only exception is if it's not self-service. So if there is a staffed service of food that can be allowed, but self-service is unlikely to be allowed anytime soon.
So when we were in the lower levels of the dial, there were still buffets, but as you said, it was a attendant managed buffets.
Correct.
So again, on the 5-star, I'm going to clarify this again. You have to have one person's contact information from each table and where they sat. So even if they're not from the same household, which it can't be more than, you have to have one person's contact information. And this weekend I went around Boulder and went into some restaurants just to see how certain businesses that were preparing for 5-star were doing this. And there's some really creative solutions out there, whether that's a little sheet of paper on your table or it's when you're checking in. There's a lot of creative, non-costly solutions that I think a lot of restaurants are using in preparation for this. But one person's contact information for the table. Do we know if the outdoor event capacity will change with the change of levels?
It does. As far as, if we move to yellow, that increases the capacities for most of the sectors outside of retail, which is set at 50%. So it does increase. If we get all the way to blue, I think it's, you're looking at 175 capacity for events, as well as I think if a restaurant has sufficient space, you can get up to that capacity.
Okay.
So each level of the dial does either increase or decrease depending on which direction you're going. Again, retail is the one where I think it's set pretty much at 50% for all levels.
What would you classify outdoor park shelter rentals at?
I guess it depends on the function of the rental. So if, just a group of folks want to go picnic, you're limited to the outdoor gathering limits of the whatever dial level we're at. If this is an organized event, if they're renting the shelter for a wedding or something like that, then it would fall under, those kind of criteria.
And the reason being is the outdoor events guidance has pretty strict protocols about masking and social distancing and contact information for tracing and other pieces, so they can have larger numbers because they have some other protocols in place.
Correct.
Okay. When you're the performers, I'm trying to, has the performer distance changed for the distance that a performer should be from the audience? And should singers be masked even if they're 25 feet from the audience?
They don't have to be masked, but there hasn't been any allowance to reduce that if they are masked. We'll see if there's any changes when the next update to the public health order comes out, but we haven't heard of anything.
So I've had two of you on the call have asked me about the symptom checks for every guest. Don't know what industries you're in, so could you send me an email at corinne.waldout@boulderchamber.com and I'll answer those questions directly to you. I need to know the industry, specifically what your question is. I'm pretty sure this has to do with 5-star. If it's not having to do with 5-star, then I'll get public health involved to answer your question. I will put my email in the chat for everybody. I'm the person that you get all those emails from, so hopefully you could just respond to it at that point too. Yeah, so a lot of restaurants are questioning for the 5-star symptom checks, which is, we'll go through and talk a little bit about that tomorrow as well, because we're actually past time on this webinar. I appreciate everybody's patience. Thank you, Lane. The webinar for 5-star is tomorrow. Applications will go live tomorrow. If you did submit the interest form, we'll send it out. Again, the dial has not changed yet. I think we had one person say, I thought that changed earlier in the week. Has not changed. That was the feedback requested information that was sent out. When that dial change happens, we will send it out with the specifics. Be patient with us on the vaccination plans. Lane, mostly be patient with Lane. I'm just the messenger, because I think there's still a lot of moving parts on that. And yes, things are coming in and out of documents that we didn't even know were in there. So, and then again, if you have any questions in between, there's the public health email, and then you have my email, and we will see you next week.
Thank you.
Thank you.